For today's lecture, I'm going to tell you about the basic principles of preventing infectious diseases. To prevent infection, we must strengthen the immune system of our body, which can be achieved through various methods such as vaccinations, better living habits, etc. The prevention of the spread of the virus can be achieved through washing your hands, hygiene control, wearing personal protective equipment, for example masks, etc., and immediate first aid after being exposed to the source of infection. To manage the source of infection, it is important to remove the causal microorganism through cleaning, disinfection, and environmental improvement, etc. The first basic principle is washing our hands. Washing your hands the right way is the most fundamental and effective way to prevent infectious diseases. Most infectious agents, microorganisms, are more likely to spread when we touch our nose or mouth with our hands that were exposed to infectious microorganisms. Since the human body has resistance to bacteria and germs, we can prevent more than 50% of all infectious diseases simply by washing our hands properly to reduce the number of germs. This is the case when we don't wash our hands after being exposed to infectious agents, germs. In this case, we can predict that the number of microorganisms will increase up to 64 in just an hour, 4,096 after 2 hours, and over 260,000 after 3 hours. Therefore, it is extremely important to wash your hands properly before the germs on your hands multiply at an exponential pace. Now, let's find out how the act of washing our hands can be effective in preventing infection. If you don't wash your hands after defecating, the relative risk of diarrhea increases by twice. If you wash your hands, the risk of suffering a digestive disorder will decrease by 31%, and the risk of respiratory diseases will go down by 21%. Therefore, about 50 to 70% of all infectious diseases can be prevented just by washing your hands properly. Another thing that you must remember is when we need to wash our hands in each situation. When we eat food, it is important to wash our hands before eating. When using the bathroom or changing diapers, it is important to wash our hands after going to the bathroom or changing diapers. When nursing a patient or dealing with cuts and wounds, it is important to wash hands before performing the activity. However, it is also necessary to wash hands after the act since the germs, microorganisms of the patient can be spread to your hand from the cuts and wounds. It is recommended that you wash your hands frequently using soap under running water for more than 30 seconds. Also, as you can see in this image, you should go through a 6-step process to make sure that all parts of your hand are washed thoroughly. If you look at this picture, you can find out that there are still a lot of germs remaining in the hand if you don't wash your hands properly. These are the areas where the germs usually remain if you don't wash your hands properly. The areas painted red, for example parts of the palm, tip of the fingers, the area between the thumb and the thumbnail, are the areas that we often miss. The areas in yellow are the parts that we occasionally miss. The areas in blue are the parts that are generally washed well. Therefore, as you can see in this image, it is very important to apply the 6-step process when you wash your hands. Let me tell you about additional rules and precautions that you must follow and remember when washing your hands. Alcohol or benzalkonium chloride agents, which can be used without water, have a similar effect to washing your hands with soap and water. However, if your finger is contaminated with organic matters, it is recommended to use water and soap rather than alcohol-based products. If you have organic matter on your hand, alcohol may react with the matters and reduce the effectiveness of disinfection. After washing your hands, make sure to remove or dry the moisture with a clean towel, paper towel, or an air dryer. It is recommended that you wash the towel after single use or, if this is not possible, wash it and dry it as often as possible. The second is cough etiquette and respiratory etiquette. Cough etiquette is a series of basic measures for preventing infectious diseases and is one of the most basic etiquette that everyone must follow in the era of COVID-19 pandemic. In particular, the virus or pathogen might spread through your hands when you cover your mouth or nose with your hand when you cough or sneeze. Therefore, you must use a tissue or your sleeve to cover your mouth and nose when you cough or sneeze and follow proper cough etiquette. To explain cough etiquette in more detail, you should wear a mask when you cough and cover your mouth, nose with a tissue. If you don't have a tissue, cover it with your sleeve. Make sure to throw away the used tissue to a safe place and perform hand hygiene to remove respiratory secretions from your hands. When coughing, it is necessary to maintain a distance of more than 90 centimeters from others to prevent the spread of the virus. The third principle is to always wear personal protective equipment. When choosing the right personal protective equipment, you must make sure that the gear can cover and protect your entire body, including your respiratory system, eyes, hands, feet, and even your clothing from the source of infection. Also, it is recommended that you use different types of protective gear according to the type of disease, infection route, situation of exposure, behavior, and purpose. For example, when you have to come into contact with a patient who is suffering from tuberculosis, which is an airborne virus, you must wear respiratory protective gear with a high filtration efficiency. In the case of patients who are suffering from diarrhea, harmful microorganisms are secreted mainly via feces, so you must wear gloves or a gown. In the case of AIDS patients, since the HIV virus exists in the blood or body fluids, you must wear a pair of gloves and a gown if you are likely to come in contact with these types of substances, blood or body fluid. These images show the proper sequence and method of wearing personal protective equipment. You must wear different personal protective equipment depending on the situation, and this image shows the example that can be applied in the case of COVID-19. First, wear a gown and an N95 mask. Press the area around your nose to make sure that the mask stays close to your face. Then inhale and exhale to make sure there is no air leak. Next, you must wear a goggle or a face protector. Finally, gloves should be worn over the sleeves. After coming into contact with a patient who is infected, it is extremely important to make sure that the contamination does not occur when you take off your clothes. These images describe the process of taking off your personal protective equipment without contaminating your surrounding environment. The contaminated area of the gown must be rolled inside so that you can only touch the clean side. Take off your gloves as shown in the picture to make sure that your hands are not contaminated. Since your hand might be contaminated during the process of taking off the gown, gloves, mask, and goggle, you must always follow the hand hygiene procedure. Finally, remove your goggles, face protection device, and N95 mask and perform the hand hygiene process again. In general, you can simply use water and soap to eliminate most of the microorganisms in the environment. However, the use of environmental disinfectants are recommended in situations where there is contamination caused by infectious patients or pathogenic microorganisms. To reduce the harmfulness, toxicity caused by this infection, you must leave the window open and wipe the surface with a wet cloth. When using a spray-type disinfectant, it is safe to wipe it with a disinfectant duster since the microorganisms on the environmental surface can be sprayed into the air to cause negative effects. These are the list of commonly used disinfectants for environmental disinfection: alcohol type, Clorox, iodine, benzalkonium chloride, etc. Check the label attached on each product to learn more about how to use the product and the recommended dilution concentration. Lastly, let's learn how we should react when we become exposed to a source of infection. The most dangerous case is when we come into contact with the body fluid, blood, of other people, which can contain blood-borne viruses such as HIV, hepatitis B, and hepatitis C. We might get infected when the blood of others gets splattered on our mucous membrane, eye, nose, or mouth, or wounds due to an accident, cut, stab, etc. In this case, you must immediately clean the exposed area multiple times with clean water or saline solution and notify a doctor or any other medical personnel to receive proper infection prevention treatment. In addition, there is a possibility of infection when you come into contact with the feces of others or contaminated objects, hepatitis A. Since the treatment method may vary depending on the source of infection that you have come into contact with, you must check the infection status of the object or person and seek professional medical assistance. Next, let's talk about detailed rules and principles that we must follow in our daily lives to prevent infection. Our home is the most important place in our lives, where we spend the most time. Therefore, we must understand the basic rules and measures that we must follow to protect ourselves and our family members from infection. First, we must wash our hands often, especially when we come home from public locations. Before we prepare and cook food, before we eat, before and after we touch raw fruit, vegetables, and meat, and after we use the bathroom. Second, we must cook food in a safe way. Why? Because food poisoning often occurs when we choose wrong cooking methods and handle ingredients the wrong way. It is recommended not to put objects that can be easily contaminated, for example wallets, diapers, or bags, on tables, kitchen sinks, etc. Do not share personal hygiene products with other people. This is because toothbrushes, towels, razors, handkerchiefs, and nail clippers may easily be contaminated by infectious agents during use. Also, many children usually share their toys with their friends, but there are some cases where we shouldn't share them depending on the type of toys. The environment around your pets must be kept clean. You should make sure that your pet does not drink from the toilet. You must vaccinate your pets and remove their excrements as soon as possible, and you must provide your pets with clean water and a tidy house. You must make sure that your pet is not infected with mites or other pests. You must regularly clean and disinfect the surfaces that you and your pet often come into contact. It is necessary to set a proper cleaning cycle, and you must clean more often if there is a patient in your family. It is recommended that you do not put things in places where dust and pollution can occur in your home. Keep the cleaning supplies in a single place for easy use. Cleaning agents can be harmful to children, so make sure to keep them out of the reach of children. Make sure that all family members understand the importance of cleaning and participate in cleaning activities. You can even assign simple tasks to your children if you want them to take part in the cleaning activities. Next, let's take a look at the rules and principles that we must follow to prevent infection at school. According to the US Centers for Disease Control and Prevention, about 40% of children between the age 5 to 17 are absent from school for more than 3 days a year due to illness or injuries. Because children spend a lot of time in school and are more likely to be infected, I recommend the following measures to prevent infection. Make sure that sick students and employees stay at home and, if necessary, go to the hospital to seek medical assistance. Provide alcohol-based disinfectants and towels. Also teach the students how to properly wash their hands. Classroom supplies and floor and surfaces must be cleaned and disinfected on a regular basis. Always make sure that the students understand and practice the principles and rules to prevent germs and diseases, and apply strict rules regarding the preparation of meals and the handling of body fluids and excrements for the health of students. All students and employees must be vaccinated against the influenza every year, and the parents must keep their children at home if they get sick, prepare tissues and towels when they go to school, and educate their children to wash their hands often. In this lecture, we have learned about the basic principles that we must follow in our daily lives to prevent infection.